Epilepsy affects more than 70 million people worldwide and is a major burden in terms of quality of life, morbidity, and risk of premature mortality. The goal of epilepsy treatment is to achieve a seizure-free status without adverse effects. While there are more than a dozen anti-epileptic drugs, this has not resulted in higher rates of seizure control in clinical practice. There is a clear clinical need to address the most frequently encountered questions from clinicians treating patients with epilepsy. Inspire It. Inspire Neuropsychiatry Program. Investigations, recent guidelines and individualizations of treatment. Epilepsy Chapter. Puzzle Solving. Program Objective. At the end of this activity, the participants should be better able to well-diagnose epileptic patient starting from history and supporting diagnosis with examination and investigations. Discuss evidence-based treatments for the management of patients with epilepsy. Individualize treatment choices, giving consideration to efficacy, safety. Select appropriate treatment regimens in the specific situations. Course design and outcome. This course consists of 4 modules with 12 CME accredited hours, referenced with the latest guidelines from International League Against Epilepsy, ILAE, International Bureau for Epilepsy, IBE, the World Health Organization, WHO, and American Epilepsy Society, AES, and prepared by a highly professional medical team under the supervision of a neurology professors. This course is accredited from Egyptian Society of Neurology, Psychiatry and Neurosurgery, ESNPN, American Association of Continuous Medical Education, AACME, Compulsory Egyptian Medical Training Authority, CEMTA. Inspire It. Module 1. Epilepsy. Is it puzzle? The first module, under the name of Epilepsy, Is it puzzle? The module will be 3 continuous medical education accredited hours, consist of 4 sessions. The 4 sessions are: the first session, Overview, Epidemiology and Statistics, Definitions and Glossary, Risk Factors, Etiology, Pathophysiology. The second session, Semiology and Localization, Focal Seizure Semiology Description, International League Against Epilepsy Classification of Seizures and Epilepsy, Epilepsy based on seizure types, Epilepsy syndromes by ages. The third session, Diagnosis, How to diagnose epilepsy, seizure or epilepsy, adult epilepsy classification according to International League Against Epilepsy. The fourth session, Clinical Manifestations, History Taking and Tips, Examination. Inspire It. Module 2. Epilepsy. Is there an evidence? The second module under the name of Epilepsy. Is there evidence? The module will be 3 continuous medical education accredited hours, consist of 4 sessions. The first session, EEG, Overview, Specificity and Sensitivity, Types, EEG Artifact, the role of EEG in epilepsy diagnosis, the role of EEG in epilepsy treatment, when to ask and when to repeat. The second session, EEG Cases. The third session, Neuroimaging, CT, Functional MRI, Functional PET, Single Photon Emission Computed Tomography, SPECT, when to ask for, when to repeat, Neuroimaging Cases. The fourth session, Lab and Genetic Tests, Prolactin Study, Serum Studies, Pre-Anti-Epileptic Drug Start, Lab Assortment, Anti-Epileptic Drug Side Effect, Laboratory Monitoring, Anti-Epileptic Drug Level. Inspire It. Module 3. Which for whom? The third module under the name of Which for whom? The module will be 3 continuous medical education accredited hours, consist of 4 sessions. The first session: pharmacological treatment, drugs classification, anti-epileptic drug mechanism of action, new emergent medications, discontinuing anticonvulsant agents, anti-epileptic drug major interaction, titration regimens. The second session: non-pharmacological treatment, diet, vagus nerve stimulation, VNS, implantable neurostimulator, other neuromodulation techniques, counseling, surgery, activity modification and precautions. The third session: adult status epilepticus management, definition, differential diagnosis, non-convulsive status epilepticus, diagnosis, workup, management. The fourth session: anti-epileptic drug in special conditions, hepatic insufficiency, renal insufficiency, elderly, female patient, lactating, resistant. Inspire It. Module 4. Child Epilepsy. The fourth module, under the name of Child Epilepsy. The module will be 3 continuous medical education accredited hours, consist of 4 sessions. The first session: Children Epilepsy Introduction, Overview and Definitions, Classification according to ILAE, Infancy and Childhood Syndromes, Etology. The second session: Epilepsy Mimics and Differential Diagnosis, Mimics in Neonates and Children, Febrile Seizure, Benign Childhood Epilepsies, Comorbidities. The third session: Epilepsy in Children, Diagnosis and Workup. History, Examination, Initial Assessment and Studies, EEG role in diagnosis and classification, abnormal EEG in healthy children, neuroimaging role, lab and genetics role, prognosis. The fourth session: Management of Child Epilepsy, section of AED, drug-related consideration, seizure-related consideration, management of children status epilepticus, refractory seizures management, non-pharmacological measures, parents' education.